Well, hello everybody and welcome to this live stream. My name is Dr. Wayne Phimister. I'm a family doctor and associate professor at the University of British Columbia in the Department of Family Medicine. And my big heartfelt mission and passion is to help people with chronic pain. So that's why I'm here tonight, and I'll be here every week sharing another topic on the subject of, well, how do you heal chronic pain anyway? Because everybody wants the pain to go away. But our current medical model focuses on treatment and symptoms and management, whereas my focus is on healing it, curing it. And my research over the years and my clinical practice over the years has clearly shown that this is possible. So that's why we're here. Welcome if you've never seen me on live stream. I look forward to sharing pearls with you so that you can get some help on this subject. So tonight's subject matter is nasal breathing. Now, this is something I've recently come across in my research, my reading, and in particular, it's something called the Buteyko breathing method. That's right, the Buteyko. How do you spell that? It's Buteyko breathing method. And this came from a physician in Russia in the 50s and 60s who was the Olympic coach and or Olympic doctor back then, and he was able to figure out this physiology of what it is to slow, shallow nasal breathe for helping pain. So the clinical benefits of this are quite clear, and I must thank the author of the book called The Oxygen Advantage, Patrick McEwen. He's a fella from Dublin in Ireland, and he cured his asthma after spending some time with Dr. Buteyko in Russia and learned this technique and has taken this to his patients and his clientele in Ireland. He's worked with many doctors over there, and he's an international speaker on this subject matter. And it's essential if we're going to be healthy, if we're going to help our pain and help chronic diseases, then we need to optimize how we breathe. It just makes a lot of sense, right? It's the number one function we do to stay alive. And yeah, so that's what we need to focus on. So the 4 clinical benefits that I've been sharing with my patients since this research has come to me is 1, we stimulate automatically the diaphragm by slow nasal shallow breathing. So if you stimulate the diaphragm when breathing, you stimulate the parasympathetic nervous system. That vagal tone is increased, and all of a sudden you calm down. And several patients this week have noticed that they just got calmer, and it just helped them get through their day when they start to slow nasal breathe. The second benefit is you increase blood flow to the tissues, which is a great idea because in chronic pain, the soft tissues and the areas that are in pain lack blood flow. So when you slow nasal breathe, you increase carbon dioxide, and you also increase a gas called nitric oxide, which is produced in the nasal passages behind the actual, this part of the nose, and it's in the turbinates on the inside of the nose. So you increase these 2 gases, and as a result, you get vasodilation or increased blood flow to the tissues that you need, which is a very helpful thing. Now, the third thing is you increase the oxygen uptake, so the oxygen gets to the tissues where they need to because there's more blood flow, and then the oxygen is taken up more effectively, and that's what the science shows. So again, yet another thing, chronic pain is about lack of blood flow to the tissues, something that Dr. John Sarno identified many years ago, and also some papers have shown that you get blockage or occlusion of blood flow or arteries to the tissue, especially in spasms in severe cases. And that's what chronic pain is happening. That's what's going on physically. So we increase oxygen to the cells. A little tip, but essential to know. And the last final thing is it reduces irritation and therefore inflammation in the airways and in the tissues. And if we reduce inflammation, then we can allow more blood flow and therefore help healing. So 4 clinical things happening in our bodies when we slow, shallow nasal breathe. So the tip this week is something called the BOLT score. Now, BOLT is B-O-L-T, and it's called the breathing oxygen level test. So how much oxygen is in your breath. And I'll give you a laugh. You know, I was practicing this, and after several weeks, I realized, oh, I was doing it wrong. So it's really important to go over this once again with you. And it's I'll demonstrate as I go through this. So you just slow nasal breathe, and then on the exhale, you hold your nose, and then that stops all potential breathing in. And then when you start to hold your nose, you start the clock. So either look at a wall clock or your watch or even your phone, and then you wait. And you just be in a state of relaxation, and you wait to see how many seconds pass until you need to breathe. Now, this is a very natural, calm thing to do. You don't want to push it. You don't want to hold that breath longer than you really need to. It's not a breath holding exercise. It's an assessment of how long your body needs oxygen. So you may get a contraction of your diaphragm. You may get a swallowing action. Something happens with me quite a bit. Or you may just get that desire to breathe. So that's how long can this time go on. Now, if it's 10 seconds or under, that's very low. It's actually quite common in athletes because they do lots of hyperventilation when they exercise, which is not healthy. It's common if you've got asthma or other maybe nasal congestion problems. So under 10 is low. 20 is what you're looking for in the initial stages, and if you got 20 when you just do this off the bat, then it's a good score. But the goal is to increase the number to 30 and then 40 seconds, and this will optimize your physiology of breathing and your uptake of oxygen to the cells. So my encouragement this week is spend some time just doing some bolt assessments, and say it's 20 seconds or say it's 10 seconds. Then what you want to do is just practice the breath holding. And hello there, just say hello to all my people listening. So you say it's 10 or 20 seconds, then you can just practice some breath holds. And if you can only do it for a few seconds, don't worry, just do a few seconds and then maybe spend 15 or 30 seconds resting in normal, slow breathing with the mouth or the nose, and then go back to breath holding and build up that time. And I would do cycles of 5 or even 10 with a minute in between. So practice, do a minute of normal breathing in between, and then do another breath hold practice. And it's typical that your bolt score may go up by a few seconds by the end of that practice. And over several weeks, it may go up to the 20 mark or even higher. So that's my encouragement. Start slow, take your time, and the higher it goes, the better your physiology will become. And you should notice some changes, not necessarily in the pain levels in the short term. I think that's a more long-term benefit, but just levels of calmness or maybe reduced anxiety. So just be careful with this. Don't push it. And if you want to take a break, that's great. You know, I'm encouraging my patients and myself to do it 3 times a day. And that's what I commit myself to do, is I learn this stuff and implement it into my life. Because at the end of the day, if we're breathing better, then we'll be healthier. So nasal breathing, which is not known in the traditional medical circles. I know there's a lot of chiropractors and other healthcare professionals, naturopathic physicians who know about this, and they're encouraging patients to do this also. But it's been a wonderful addition to my toolbox, for myself, but also for my patients. And this is the 5th approach of treatments that I have, and all you out there listening to me who know me in person, or maybe my patients, and the other modalities, hopefully you're working on, which is the food and low anti-inflammatory diet, the Wim Hof method, which is focused on cold exposure, and the CBT or the IACT. These are just brain programs or brain activities to optimize brain function and brain and neuroplasticity, which is all about how do we heal pain from the mind-body connection. So these are 4 of my treatments that I encourage people to do in their own time, and obviously in the office, my own technique of advanced trigger point injections, which is a way of releasing the tension that builds up in all patients with chronic pain. And my technique focuses a whole body approach of muscle and fascia to release that, so that this fight-flight response can be switched off, and this healing, relaxing, rest and repair part of the autonomic nervous system can be switched on, and thus aiding this journey ever closer to healing chronic pain. So there you go. It's been great to see a few familiar faces tonight. Thank you for joining me, and I look forward to my next live stream, which will be in 7 days' time. So thanks so much. Take care. All the best. Bye. Thanks for joining the course. I look forward to seeing you next time.